The GIT, the most dilated part is the stomach. As you can see, the stomach has these features. It has anterior surface, posterior surface, yes, and it has two border. Here, left, and here is right. Okay, we divided the stomach in four parts. The most superior part is the fundus. Here is the body. Inferior to body, we divided this part as pyloric part. Pyloric part has two parts. Here is pyloric sphincter and here is antrum as pylor. Yes. Also, it has two curve or two curvature. The curvature are the location of the border. Here is
Greater.
yes, greater curvature. Here is lesser curvature. As you can see in the lesser curvature, at the site of attaching the body to the pyloric antrum, you can see a notch. Yes, this is named angular notch or incisura angularis. Okay, angular notch or incisura angularis. Also, when the greater curvature attached to cardia, attached to esophagus at this level, which is the level of the cardia, you can see another notch. It is named cardiac notch. As you know, greater curvature is the site of attaching.
Greater omentum.
Here, yes, here is the fatty of greater omentum, and lesser curvature is the site of attaching of lesser omentum. Also, at this area in the lesser curvature, you can see two arteries. Yes, this artery is left gastric, because left gastric travel from superior to inferior, but right gastric travel from inferior to superior, which tease these two arteries anastomoses together. At the level of here, at the level of greater curvature, also you can see another two arteries, which are named right and left gastroepipyloric artery. Yes, right gastroepipyloric artery is a branch of
Ciliar.
no,
Common hepatic
common hepatic.
artery.
No, no.
Is
The first branch of the superior mesenteric artery. What is the name of it? Inferior pancreatic duodenal artery. And here, as you can see, left gastroepipyloric is a branch of. It is left. It is near the spleen.
a splenic artery.
So it is a branch of splenic artery. Yes, and also near the fundus and cardia, we have another vessels which are named short gastric arteries. Okay, short gastric artery. When we see the mucosa, as you can see, when we see the mucosa, you can see some grooves which are named gastric roga. Okay, and the gastric roga, which are located near the lesser curvature, are longitudinal. Look at here, they are longitudinal, which this roga are susceptible to peptic ulcers. Okay. The liver is the greater gland in your body, which it has two lobes, left lobe and right lobe. Left lobe is just 1/6 part of the lobe. Right lobe is 5/6 part of the lobe, which these two lobes are separated from this structure. Anteriorly, the side of attaching of the falciform ligament separate these two lobes, and when I look at to the posterior, I see that posteriorly these two lobes are separated by these two fissures. Here is fissure of ligamentum teres, which ligamentum teres is located in this fissure. Okay, and ligamentum teres inferiorly attached to falciform ligament. Superior to ligamentum teres, we have fissure for ligamentum venosum. So ligamentum venosum is located in this fissure. So completely ligamentum venosum, ligamentum teres, and
Falciform.
falciform ligament separate these two lobes from each other. Also,
There was another ligament, round ligament.
No, that's in.
ligament.
round ligament. Round ligament is located in the uterus.
But there was
Yes,
something
the-
like that.
The
Yeah, it's
pelvic
in-
cavity.
but
Another name which is also is named round ligament. Yes, but here we usually in the liver we said it teres ligament. In the uterus we named it round ligament. Also teres means round. Okay, you are true. So here is the superior surface of the liver. At the superior surface you can see a depression. It is named cardiac depression because the heart is located at this area, and between the heart and liver we have diaphragm. Yes. Here is anterior surface. It is right surface. This area, look at here, this area is posterior surface, and this area is visceral or inferior surface.
Irregular.
Okay? What?
Irregular.
Auricular?
Yes. Irregular.
Irregular. Yes, irregular surface in this area. So, right lobe also contains two lobes. Okay? Here all of this area is right lobe. It contains two lobes. Inferior is named quadrate lobe. Yes. Which quadrate lobe? Quadrate lobe is located between this structure.
The pile.
Between teres ligament
And gallbladder.
and gallbladder, and superiorly
Hilum.
porta hepatis or hilum. Yes, hilum or liver or porta hepatis. Superiorly we have caudate lobe. Caudate lobe is located between ligamentum venosum,
Venosum.
IVC, and
Hilum.
porta hepatis. Yes. Another structure at this area is, look at here, caudate process. Here is caudate lobe. This part is caudate process. Caudate process attach caudate lobe to another part of the liver, and it is located just superior to porta hepatis. Okay, and also we have a papillary process at this area. It is a small process which is located inferior to caudate lobe. At this area is named papillary process. Okay. Another structure at this area is the structure which is created by the attaching the peritoneum. As you know, the site of attaching of peritoneum at this level made the porta hepatis. Yes. So when peritoneum attached to porta hepatis, two layers of peritoneum separate from each other and cover all of this surface. Yes, cover all this surface, which anteriorly these two layers made falciform ligament, and falciform ligament arrive to anterior abdominal wall. However, these two layers at this area, they reflect on the diaphragm, okay, and make this ligament inferior or posterior coronary ligament. Also, anteriorly, this layer, which also at the anterior part arrive to diaphragm, is named anterior or superior coronary ligament.
Doctor, here, inferior or posterior?
Yes, it is located in the posterior surface,
Yeah.
so we can name it
Posterior
posterior.
coronary.
And it is located inferior
inferior of the
compared to
liver.
this, so is inferior.
So it's right. Which?
No, all of them are right. You say inferior or posterior coronary ligament. Also, these two coronary ligaments at the right side, when attached together, they made right triangular ligament. Okay, and at the left side, as you can see, this is the coronary ligament at this level, and this is coronary ligament at this level. Yes, at the left side they made left triangular ligament. Bare area is the site which is bare from the peritoneum. Yes, and it is located between anterior coronary, posterior coronary, left triangular and right triangular. So all of this area are named bare area of liver. Okay? The structure which are located in the porta hepatis. As you can see, here we have gallbladder. This is fundus, body, neck. This is cystic duct. Okay, cystic duct attached to common bile duct. Cystic duct attached to common hepatic duct and made bile duct. Okay, so it is cystic duct. This is common hepatic duct. This is common bile duct or CBD. Okay, common bile duct. Another structure is here.
Hepatic artery.
No, portal vein. At this area you can see the portal vein here. And also here is proper hepatic artery, which are this structure are located in the hilum.
Is
Another-
because of this posterior to the artery?
Which one?
Because the vein is posterior to the artery.
At this level, they attach to the liver, but in the cadaver, when this structure are exiting from the liver, we said that portal vein is located posterior, bile duct, right side, artery, left side. So, another structure are the impression. As you can see here, we have a lot of impression which are created because of adjacent to another viscera. Yes? Yes or not?
Yes.
So, look at here. This is the site of this is the adjacency of the liver to the stomach. Yes? So, left lobe of liver travel to left side. Yes? And is located near the fundus of the stomach. So, at the posterior part of the left lobe, you can see gastric impression. Yes, gastric impression. Here we can see another impression which is located in the quadrate lobe. Look at here. Which
Pyloric.
impression made it?
Pyloric.
Yes, pyloric impression is located at this level. Another part, look at here. At the anterior at the posterior part of the caudate lobe, we have another impression with which
Cardia?
no esophagus. Esophagus enter to the abdomen. So it is named esophageal impression. Yes. So after this area, after the pillar we have duodenum. Yes. So this area which is located upper to porta hepatis is named duodenal impression. Okay? Another part. This is right part, this is left part. In the right part we have right colic flexure.
Oh.
Yes? So this impression is named
Right, Colic.
colic impression because it is created by the
Colic flexure.
colic flexure. Yes. Another impression superior to colic flexure and posterior to liver, which made the recess of Morrison.
Renal.
Yes.
Renal impression.
Yes, we have right renal or right kidney. So this area is named renal impression. And superior to renal impression, we have suprarenal impression. Okay? So this and now
The kidney and the scar.
the impression which are seen in the liver. Okay?
Okay.
Another structure is
Pancreas.
pancreas and spleen. As you can see, the pancreas has this part. This is anterior, this is posterior.
Posterior.
How you recognize the anterior and posterior?
From the C shape of the duodenum.
So C shape of duodenum is located in both anterior and posterior. Yes, this C shape at the posterior view is located to this side, but in the anterior view another to opposite side. And also, when you find this vein, which vein is this?
Splenic vein.
Splenic vein. Splenic vein is always located at the posterior surface of the pancreas. Okay, so it is a splenic vein. A splenic artery is always located at the superior border of pancreas. Here is
Splenic artery.
Superior border.
splenic artery at the superior border of the pancreas. So, in the pancreas, you can see here is head, neck, body, tail. Okay? You can see two ducts, main pancreatic duct
And accessory.
and accessory pancreatic duct. Main pancreatic duct attached to bile duct and insert here at the major duodenal papilla. Okay? Here is major duodenal papilla. Here is accessory pancreatic duct, which insert to minor duodenal papilla. This is first part of duodenum, second, third, and fourth part of duodenum. Yes? Another structure at this level. Here is
Splenic artery.
splenic
artery.
artery. So this is
pancreatic.
Left hepatic, left gastric.
common hepatic. Look at here, it is the site of the celiac trunk. Okay?
Okay.
They are two branches of the celiac trunk, and one branch of celiac trunk is
Common.
left gastric, which travels superiorly. But splenic, common hepatic artery. From common hepatic artery, you can see this branch. What is this? Gastroduodenal.
Gastric.
Okay? Gastroduodenal artery, which travels inferiorly. Another structure at this level,
This vein.
this vein. Yes. This is splenic vein.
Inferior
This is
mesenteric.
inferior mesenteric vein. This is
Superior
superior
mesenteric.
mesenteric vein. This is this artery.
This artery.
Superior mesenteric artery.
Superior
Okay?
mesenteric, because it's
Superior.
behind it.
Yes, superior mesenteric artery. Splenic and superior mesenteric vein attached together and make portal vein. Yes, portal vein here, bile duct. Look at here. Here is the bile duct, and another structure at this level. Which structure are them?
Superior and superior mesenteric
Superior
vein and
mesenteric artery and vein, which are passing anterior to
Duodenum.
third part of the duodenum. Yes.
Doctor, what
What?
about this small? Or is it?
They are pancreatic duodenal. The gastroduodenal travel inferiorly and made which branch?
Pancreatic.
Pancreatic duodenal branch. Yes. They are the branch of the pancreatic duodenal. Also, they are the branch of inferior pancreatic duodenal. Inferior pancreatic duodenal is a branch of
superior.
superior mesenteric. Superior pancreatic duodenal is a branch of
Celiac.
from celiac is common hepatic. From common hepatic is the gastroduodenal. From gastroduodenal, superior pancreatic duodenal.
Alright, this is the common hepatic artery.
Yes.
And then which one is the gastroduodenal?
This
Okay, this. And this one is the pancreatic
pancreatic
duodenal.
duodenal. Yes. Here is the hilum of the spleen. Okay. Here is the lateral surface. Here is all of them are visceral surface.
Posterior surface.
Okay. No, here is anterior. This is anterior surface, posterior surface,
Yes.
lateral or diaphragmatic surface of the spleen, and another structure. Also, at this moulage, structure of this. For example, this is posterior part, yes, At the posterior part, you can see splenic
Splenic
vein,
inferior
inferior
mesenteric,
mesenteric vein,
superior
superior
mesenteric.
mesenteric vein. Which process is this? Yes, uncinate process. Because superior mesenteric artery and vein travel anterior to uncinate process. This is head. This is bile duct. Yes, bile duct at this level. Which structure is this?
Is the mesentery.
Yes, it is the site of attaching the mesentery. Yes, and yeah, this is celiac trunk. This artery which travels superiorly is
Gastric.
left gastric. This is splenic. This is
A common
common
hepatic.
hepatic. This is
Duodenal.
gastroduodenal. Yes. This is main
Pancreatic.
pancreatic duct, accessory pancreatic duct. Yes. And here you can see the branch of the
Inferior.
superior mesenteric artery. Okay? The branch which are derived in the right side. Okay? The first, which artery was there? Who know?
Where?
Yeah.
The inferior is for the superior mesenteric.
No, it's inferior pancreas. Pancreas or something. It's like
Uh,
Yeah, inferior
Duodenum?
pancreatico duodenal.
No. Think.
what's this part? Actually, so that we can think about it more.
This is the mesentery, mesotransverse colon.
Yes, mesotransverse.
Middle.
And
Are these branches of the middle colic artery?
Yes, exactly. They are middle colic. Middle colic is the second branch of the right side of superior mesenteric artery, which insert to transverse mesocolon. So after this branch, here you can see at this part another branch. Okay, which branch are there? Here and here. Right colic and
Iliocolic.
iliocolic. And another branch. This branch are
these are
Inferior.
sigmoidal, superior,
Yes.
distal and left.
they are branch of which artery?
Inferior mesenteric.
Inferior mesenteric artery. So if I look to the anterior part, look at here. It is the origination of the inferior mesenteric artery. Okay, which inferior mesenteric artery has this branch: left colic,
Colic artery.
sigmoidal, and the superior rectal is not seen at this level. Superior rectal go to the pelvic.
But it's
Okay,
a branch of the
it's a branch of inferior mesenteric. So you should know left colic,
colic,
sigmoidal branch.
sigmoidal branch.
Here, right colic,
Colic.
iliocolic, middle
Middle
colic.
colic.
Here is transverse mesocolon. Yes. And also you know the arteries here. This is, look at here, cecum, appendix, ascending colon, left colic flexure, right colic flexure, descending
Sigmoid.
sigmoid. Okay. And at this level, this is
The valve.
ileocecal valve. Yes, ileocecal valve, which it has inferior lip, superior lip, right frenulum, and
Left frenulum.
left frenulum. Okay, this is the orifice of
Appendix.
yes, orifice of vermiform appendix at this level. Okay, this is teniaculi, yes, which you can see here. How many teniaculi does we have? Three teniaculi, yes. Teniaculi at the ascending colon are divided into anterior, posterolateral,
And medial.
and posteromedial. But in the transverse colon,
Only
the teniaculi are
Only anterior.
anterior, posterior, inferior. Okay? In the transverse colon, the tenia coli, which is located posterior, attached to transverse mesocolon, so is named tenia mesocolic because attached to transverse mesocolon. Anterior part of the transverse colon attached to
You mean the tenia colon and the posterior surface of the transverse colon?
yes,
Right.
yes. Anterior tenia coli of the transverse colon attached to which structure?
Omentum, greater omentum.
Greater omentum. So it is named
Omentum.
tenia omentalis.
Tenia
Yes, tenia omentalis. Inferior tenia coli in the transverse colon does not attach to any structure, so it is named tenia libera. Libera means free. Okay? Finished? Okay, stay here.